Hello, everyone. Happy September. I just recently returned from San Diego, where NAC held its annual convention for community health centers. And the conversation that dominated the hallways and the convention rooms was about the risk of an impending federal shutdown. So I'd like to talk a little bit about the implications of a shutdown and maybe how you can lend your voice to divert this into a more positive direction. So, to set the table, annually, the federal government must either pass a budget that funds the government from October 1 through September 30th, its fiscal year, or it must pass a continuing resolution that funds the government at the existing levels of spending. In the absence of a budget or continuing resolution, the federal government shuts down. And that means that many of the services and the benefits that our communities rely on, that we rely on, they're not there. There's a skeleton crew. The most essential services are funded, but the rest is at risk. Back in June, there was an agreement between President Biden and Speaker McCarthy to end the debt ceiling standoff. The debt ceiling was raised, and there was agreement upon the spending levels for the new fiscal budget. Since that time, the culture wars have intervened, and there is a real risk that we won't have a federal budget agreed to by the end of September. And that creates problems for the people that we serve, for our fellow health centers, and for us. For the people that we serve, the poor, the underserved, they rely on benefits that will disappear. In some cases, that's food assistance. In some cases, that's child care assistance. There was funding in the American Rescue Plan that provided for child care, and that funding has not been reauthorized. It dissipates come September 30th if nothing is done. That has real world impacts for the people that we care about. For the community health center movement at large, we have our funding that needs to be reauthorized. We have mandatory funding and discretionary funding, but it's the funding that keeps the health centers open and provides for the funding to serve the uninsured and the underinsured, which is a significant part of our patient population. That funding needs to be reauthorized by the end of September, or that funding is not available for anyone whose grant year it comes due come September 30th or whenever the government reopens. For us, it creates a real risk around cash flow. Now, we've done a number of things to help support us in the short term, and we're prepared to weather it. Thank goodness for the work that's happened over the last fiscal year, but that's a short-term measure. We really do need to have these issues resolved for long-term sustainability. We're at risk if we don't have those things resolved. You'll remember this graph. This talked about the path of our organization over the last fiscal year, and where we thought we were going to be significantly underwater, we actually ended the year with a surplus. And that surplus has given us the resources to weather a short-term shutdown. This model, again, you may remember, explains what drives sustainability within health centers, and it's based on data collected by Capital Link. And we've been able to keep our staffing costs low, and we have found ways to level up our revenue, and that has given us that ratio of under 72%. This is what we did in this last fiscal year, and we brought in our staffing ratio at 66% of the operational revenue number. So what does that mean? It means that we have cash. We have the ability to keep the doors open because we're operating very lean and with the resources to get us through. But that's not a situation that can go on for months and months and months. We really do need to see action from our legislators and our supporters at the state and federal level. So, where can you help move the conversation forward? Well, locally, of course, we need to be connected with our patients and clear in our message that we are here for you, that we've done the things that we needed to do to keep our doors open, to keep services available, and that we will continue to pour our hearts and our souls into serving this community the way that we have for 50 years. At the state level, we have been fortunate to have really strong support at the state level. They've provided our health center with resources that helped us navigate this last fiscal year. They have also, in the new fiscal year budget, provided a significant lift to the DPH line item, and that's a piece of our funding that will hopefully help close some of the gap between the costs that we incur and what we're able to bring in. And so we're grateful for that. So you should say thank you. We want to say thank you to our friends and supporters and local electeds at the state level. We also want consideration as the state negotiates and considers a supplemental budget. And if there is a supplemental budget that is to come out of Beacon Hill, I think it's important that the health centers are prioritized and supported as we have been in the past, because we are the safety net that supports many of the residents within Massachusetts. And then finally, at the federal level, the message is this. We have traditionally been supported by bipartisan majorities. Supporters in red states and blue states love the community health centers because of the impact that we have on their constituents. We want to see that support continue and to be proclaimed boldly. We need to have the federal government fund our health centers in order for us to remain viable and a critical component of the public health safety net. The time to do that reauthorization is now. And so we're asking both the House and the Senate to really come together and find a way to settle on and approve funding levels for our FQHCs. And then lastly, I think the largest message we want to put out there is your constituents are counting on you to fund the government. We don't want to see a shutdown. It is counterproductive. We want to see our health centers, the people that they serve, and our country at large supported by the leadership that we deserve. And so please come together. Let's get this figured out, and let's keep the government open. Let's take care of the people that we love. Thank you, folks.